we see in society, in the public, is a lot of men, having baldness because it's very visible. And it is a very misconception that only men suffer with baldness. Actually, women also have this condition. So in men, medically we call it as androgenetic alopecia. So it is basically, the baldness is called androgenetic alopecia. In females, we have a specific term, we call it female patterned hair loss. So both of it is actually nothing but the baldness. So the reason behind this is that as you hit puberty, your hormones, your male hormones tend to increase, and the hair on your front area, your frontal and your crown area, actually are sensitive to these testosterone. So the hair follicles in your the front area, your crown area, are actually a little sensitive to these testosterone hormone. So testosterone hormone, once it is increasing in the puberty, it actually causes growth of your beard, your mustache, your all these kind of your axillary hair, pubic hair, but it causes your hairline to recede at puberty. So in children we see that the hairline is quite ahead, beyond the forehead. Some children might be having fine hair even on the forehead. So once the puberty hits, there will be a definition of this hairline during the puberty. And then some people who have the tendency of this baldness pattern, in the later ages, there will be recession of this hairline also, and then sometimes even baldness starts in the crown area and the frontal areas. So mainly the androgenetic alopecia, we see that is genetical mainly in the maternal side, that is the mother's side. More than your father's family having the baldness, the more important is your mother's side, that is your maternal uncles, your maternal grandfathers, grandmothers, the entire maternal wing is the cause for your baldness. So that is a gene that is more that is more troublesome. That is one thing. And then definitely some nutritional deficiencies are actually going to add up to all the damage. So you need to correct your nutritional deficiency in order to see some benefit. Then having excessive sugars, diet also plays a very important role in baldness. So having excessive sugars, having insulin resistance. So insulin resistance in turn was going to increase your androgen levels, and insulin resistance is going to increase your insulin-like growth factors, which is going to increase your androgen levels and in turn cause more damage to your hair follicles, hence causing baldness. So it is like a vicious cycle. So you need to be very careful about what you eat. And then some men, in order to hide their baldness, also start wearing caps or some headgears, and then wearing excessive helmet. All of this is going to cause friction, cause moisture accumulation, unhygienic conditions, which will again further aggravate this condition.